speaker is going to be Jane Topolovec, Vranic. She's going to talk about some anatomy, some of the basic underlying issues about how the brain is organized and how these relate to some of the mental health issues that we can see after brain injury. So Jane is a scientist here at the Keene Research Center of Ukraine at St. Michael's Hospital. Her primary research aims are in the area of brain injury. She studied biomarkers that are used to diagnose and predict various outcomes associated with traumatic brain injury. She's developing some and studying some innovative ways of helping people with depression after brain injury by using the internet and other means. Her research focuses on improving post-concussive symptoms such as depression, headache, and dizziness. So Dr. Topolovec is going to speak to us, please.
Thank you, Michael, and thank you everybody for coming this morning on Saturday morning. So I've taken on this topic of neuroanatomy and psychiatric issues, and it's really some of the mental health issues that we've touched on a little bit this morning. My talk focuses a little bit more on depression. I'm going to present a bunch of anatomical structures in the brain, and it's not to have you memorize them all, there's no quiz, but really the goal of today, what I'm hoping you can take away, is just this understanding that there are actual physical changes in the brain that happen that are associated with depression and a lot of the other symptoms of concussion. And that's why when we hear this idea of just shake it off after an injury, or why can't you just get back to how you were, it's not that simple. There are complicated physical and chemical things that are happening within the brain that make it a little bit more difficult than just to kind of move on. I have three goals to my talk. One is to actually let's take a look inside the brain, which we've been talking about all morning. The second goal is to try to convince you of what I was just saying, that there are physical changes within the brain that mediate some of these post-concussive symptoms that we've been talking about. And then the good news of that is show how by treating some of these conditions we can actually change the wiring of the brain to improve symptoms. And as Dr. Cusimano mentioned, just briefly present to you some of our work that we're doing here to try to develop innovative and accessible ways for people to access treatment for depression after a traumatic brain injury. So this is a nice colorful diagram of the human brain just to get us oriented. And generally we talk about these four big areas: the frontal lobe in the front, this blue area in the middle called the parietal lobe. Towards the back we have the occipital lobe, and then just above our ears is the temporal lobe. So these are the outer cortical areas, and we'll also be talking a little bit about some of the deeper structures within this area. And you can see in this diagram a representation of where the spinal cord comes from. It's just like to show you what the actual brain looks like. I'm sure many of you have maybe seen images of it, but you don't want the impression that the brain is so nicely color-coded. And you can see here that we have a lot of these bumps and grooves and lines that all have their own names and also their specific functions within the brain. This is a protective layer covering the outside of the brain. You can also see here some of the blood vessels that bring oxygen and energy to the brain to help us function. In terms of just going back to this diagrammatic view and some of the areas and their functions, we think that the frontal lobe is very much responsible for kind of who we are, our personalities, the way we think, the way we solve problems, as well as behaviors and regulating our emotions, so things such as aggression, as well as depression, which we're going to talk about a little bit more. Also, this is actually within the frontal lobe, but it's called the motor cortex, and this is what's letting me wave at you as I stand here today and speak to you. It's all the gross motor movements that are world around us, as well as some of the higher, more complex functions that we do, such as math and even spelling is actually a pretty complicated function that we are able to do. The back of the brain, the occipital lobe, is primarily responsible for vision and bringing in all the information from our visual system and sight. And then the temporal lobe has functions in terms of memory and language and how we understand things that are told to us or that we read or hear about. This is a very kind of high-level overview, and I just wanted to take a little bit of an aside because I'm going to be showing some other slides that have different views of the brain in different sections. And when I say some of these names, you might understand what I'm referring to. But one view that you might see is this, what we call a coronal view, and that's basically if we were to slice the brain kind of from one ear to another, and it lets us see kind of from one side to the other side of the brain, as well as from the top to the bottom. When we take a section that goes right through our midline, through our nose, we have the sagittal view that lets us see the front to the back and the top to the bottom. This image also shows you, so we've talked about this cortical area, and then we have these deeper structures within. This is called the brain stem, upon which these cortical areas rest, and then we have our spinal cord going to the rest of the body, which brings the information in and then sends the information out. And then the third view is this axial view, which is sliced right through the top of the brain, and we can see kind of the front of the brain and the back, one side to the other. And then as we take consecutive slices, we can follow the patterns from the top to the bottom or the bottom to the top. So to get into some of these deeper structures that are really integral in a lot of mental health and psychiatric conditions, we have this diagram. So it's meant to depict the outside, the cortical areas that we talk about as translucent or transparent, so that you can see really within some of the deeper areas. This blue structure is called the thalamus. And again, you don't need to remember all this, but it's just, hopefully hearing some new terminology today. We'd like to make you feel like you've left knowing a little bit more about the brain. And the thalamus is considered to be a relay center. So this area is where all the information comes into our brain, and then the thalamus basically decides which other parts of the brain the information should go to. This structure, this circular shaped structure here is the cingulate cortex, and it's been shown to be very important in a lot of emotions, and including depression and anxiety. The frontal lobes, as I mentioned previously, here in the front also have an important function in our emotions, including depression. There's an almond-shaped structure right deep within, between our ears, that's called the amygdala, and it has functions in both anxiety and depression. And then the hippocampus, which you may have heard of before, is this area here, which is very important for memory, and it's thought to be very sensitive to disruptions in the brain, and that's why memory issues are common, potentially after any types of insult to the brain. Another view is the sagittal view, as I mentioned, taking a slice right kind of down the nose, and so that we can see the front to the back of the brain. This is the cortical areas we talked about, and then the brain stem. And the brain stem is critical because it has a lot of the areas that regulate our autonomic functions. So these are the things that we don't think about that we're doing as we're sitting here, breathing, and how our heart beats are all regulated in this area. And there's groups of cells here that create chemicals of our brain and nervous system, the neurotransmitters. So for example, the raphe nuclei down in here are important in depression, and they release serotonin. And that serotonin gets passed on to the frontal lobes and other areas, the cingulate cortex in here, to be related to addictions, including gambling and substance abuse and some of the things we talked about today. So that's the overview of neuroanatomy, the anatomy of the brain and some of the chemical structures within, and really to see it is a complex and integrated system that if any one of these areas becomes disrupted, you can have changes in emotion, cognition, and all these things that physical symptoms that are also associated with traumatic brain injuries. I'm going to shift now a little bit to how we look and how we take pictures of the brain in living individuals. These are several non-invasive techniques that have been developed over the last 100 years that really let us take pictures of the brain, both in terms of the structure as well as more recently the functions of what's happening inside the brain, what areas are more active or involved when we do certain tasks. And so you may have heard of PET scans, EEG images, CT or CAT scans. We also have magnetic resonance imaging, and then an adaptation, a more recent adaptation of that is functional magnetic resonance imaging. So here are, this is two sections, axial sections from the same individual taken by CT scan. And one thing that I wanted to point out here, this is actually images of someone who has sustained a traumatic brain injury, likely struck their head in this area. But it's important to note that these areas are contusions, these brighter areas, and we can't necessarily predict where these contusions happen in the brain. And it's not like having a heart attack, where the heart has its own function, you know, when you have a heart attack, what to expect. This is what makes it very difficult sometimes to diagnose and know how someone's going to be recovering after a traumatic brain injury, because the injury, depending on where it is in the brain, can have different manifestations. And this is actually something you would see someone with more of a moderate to severe injury. And for someone with a mild injury or a concussion, there might not be any overt signs such as these. Magnetic resonance imaging is a similar type of imaging, but it allows us to look in more detail with higher resolution. So if someone is having persistent symptoms, for example, that can't be detected, and there's something that can be found on a CT scan, they may be advised to have an MRI scan to see if we can find any lesions or changes within the brain. Functional magnetic resonance imaging is really an exciting, relatively new technology over the last 20 years or so. It's been growing, and it's based on the premise that the oxygen in our body and in our brain has hemoglobin in it, and hemoglobin has iron in it, and iron is susceptible to magnetic fields. And so when you have an increase in iron going to one area of the brain that's being activated, so for here these are examples of areas that are activated during a painful stimulus, then we can detect that on this type of scan. And functional MRI has now been used to study all types of activities and sensations and functions that our brain does. And it really lets us take a look inside what's happening. I'm being pushed along here. So I just wanted to show you a few sections from one individual looking at areas that are activated during depression. And in here is the thalamus, which we talked about, the amygdala. Up front here we have the cingulate cortex. We've also looked at functional MRI and traumatic brain injury, and these are areas that are hyperactivated in individuals with traumatic brain injury, and this type of research suggests that maybe the brain after traumatic brain injury is working harder to do some of the same tasks that a healthy adult is able to do. And when we look at functional MRI and depression and traumatic brain injury, this one study, again, there's very few studies, this is a very innovative area of research, but looking at military personnel with a traumatic brain injury and depression have shown increased activity in the amygdala, which we talked about. And then another adaptation of magnetic resonance imaging is this diffusion tensor imaging, and it shows how water moves in the brain in a magnetic field. And in this slide, you can see that in an individual with traumatic brain injury and depression, the projections of these green areas for people who are colorblind, I know there are some that are much reduced after an individual with traumatic brain injury. And DTI is thought to be much more susceptible to early changes in brain anatomy after an injury, and so this is being explored as a potential biomarker for concussion, things that don't show up in our traditional CT or MRI scans. And this slide, this second slide is just looking at suicidality with veterans and also showing increased connectivity in the cingulate cortex for individuals who have high levels of impulsivity and suicidality. So I hope that this has convinced me that there really are changes, structural changes and functional changes in the brain associated with these mental health issues. And we can actually look at changes. So this are scans from a healthy individual. And these are some scans from individuals with depression. These are not traumatic brain injury related. The study hasn't been done yet in traumatic brain injury. But you can see that once patients are in remission, even several years later, their brains are starting to look more like healthy control subjects. So there have been several websites developed that deliver treatment, and by that it's exercises that help build skills to rewire some of those connections in the brain. And these are a couple examples of ones that we've studied, but we are in the process of developing a program that's specifically geared for someone who has unique needs after traumatic brain injury, including physical concerns as well as cognitive issues and difficulty with concentrating and attention and understanding. And this is work that's under progress here at St. Michael's Hospital. So I know I've gone over time, I apologize, but I hope that we got a chance to look inside the brain today, that I have convinced you that structural changes and physiological changes that are happening, and just presented briefly some of the innovative work that we're doing here in this area. So thank you.
Hi.
Hi.
I was wondering if you have any particular biomarkers that you're currently researching or published.
Any specific biomarkers or?
I'm mainly wondering about specific proteins or anything that you're detecting in blood or that correlate with TBI.
Yeah, so the term biomarker is a general term, and it can include both proteins within the blood or in the cerebrospinal fluid or even neuroimaging. So a biomarker is really an indicator of something that's happening. We've looked at blood markers. I have specific ones, but maybe we can talk about that offline if you're interested. And there's a lot of attention worldwide in trying to identify diagnostic blood tests or imaging tests that could help us in the diagnosis, especially in these concussion or mild or TBI cases.